Mr. Phillips. My name is Mackenzie. I'll be your nurse today. Can I get you to verify your name and date of birth?
Sean Phillips, 10/12/01.
Do you have any allergies?
No known allergies.
Okay, perfect. Can you tell me what brings you in today?
Well, I've been peeing a lot lately, and I've been really thirsty, very tired, and kind of a lot of profuse sweating, and just not feeling the best.
Okay, can you tell me about your diet and exercise?
Well, I walk about half a mile a day to the fridge and back. And then I'd say I eat a lot of fast food on my way home from work. I mean, McDonald's, that Big Mac meal, you just can't beat it, you know? And the $3.50 bundle McDouble and small fry, it's just pretty darn good and cheap, you know?
Mm-hmm.
I do like my Dr. Pepper, best doctor in the world, let me tell you, he hasn't failed me yet.
Okay. Sounds good. Have you ever had your blood sugar checked before?
What is that?
Okay. Well, your blood sugar is the food you ingest. There is glucose in all of that, and glucose is sugar. Abnormal levels can cause you to have all of the symptoms you are having: frequent urination, increased thirst, profuse sweating, even poor skin integrity sometimes occurs. So today we're just gonna double check your blood sugar, and then we'll go from there.
How do you do that?
Steps. So we will clean your finger. We have a little AccuCheck, and we're gonna prick your finger, get some blood out, and put it on the little strip, and it's gonna read your blood sugar and tell us. So yes, we'll do that. We're gonna wipe with alcohol, prick your finger.
Ouch.
Are you okay?
Okay.
Wipe the first one off. Okay, and it reads 350, which is
Is that
very, very high.
Oh.
So it seems that you do have type 2 diabetes. Does anybody in your family have type 2 diabetes?
Well, I think my mom did have something around like the type 2 diabetes or something. I don't know.
Okay. Would you be able to tell me what you already know about type 2 diabetes?
I know it's when you have a bad diet and nutrition intake, and you need to have a good exercise plan.
Yes, that's part of it.
Which I have, I think.
Right, and there's always room for improvement. So diabetes is a disease that has an unknown cause, but diabetes affects how your body uses the glucose in your body. Glucose is sugar that gives the body energy, and your body needs that glucose to keep running. So obesity is a risk factor, along with sedentary lifestyle, not being physically active, poor diet, ethnicity, and even age. So for obesity, it's just increasing your adipose tissue overall, which makes it harder for insulin and glucose to get into those tissues, which can lead to insulin resistance. Normally, insulin is released after you eat, and those sugars get to flowing in your body. So then it's hard to convert it to energy. When there's not enough insulin in your body, your pancreas is what produces insulin. So your pancreas will try to make up for what your body is lacking of the insulin that is converting this. And when it can't keep up, the sugar in your blood just overloads your whole entire body, and it gets into, it stays in the blood, which causes that high blood sugar. If you're experiencing high levels of glucose, it's called hyperglycemia, which is high levels of sugar in the blood. So symptoms may include, but not limited to, extreme thirst, increased appetite, drowsiness, blurred vision, polyuria, which is having to pee more often. The opposite of this is when your blood glucose is low, so if you're not ingesting enough. It's called hypoglycemia, and symptoms include shaking, fast heartbeat, sweating, impaired vision, weakness, fatigue, headache, and if diabetes is left untreated or poorly managed, it can cause complications. And diabetes can damage your blood vessels in your body, which can lead to stroke or heart failure, peripheral vascular disease, kidney disease. Because the glucose is like little tiny razor blades in your blood, and so it will just damage your body if it's not treated correctly. Many diabetic patients are prescribed insulin, so this is medical management to treat and help manage your diabetes. The purpose is to help regulate the glucose levels in the bloodstream, along with storing glucose in the liver, muscles, and adipose tissue. And then from there, it will be able to convert the glucose to energy and regulate blood sugar in your body.
So is my pancreas just not strong enough, or what? I feel like I'm pretty strong.
You are pretty strong. So your pancreas does produce your insulin, and it's not that it's not strong enough, it's just that your body can be resistant to that insulin that's being produced, and so it makes it hard for your insulin to convert the glucose into energy. So that's why with insulin injections, it's giving you more insulin to make up for what is being lost.
Well, so what do I do then to help with this?
Okay, so for your insulin injections, before meals, you will check your blood sugar, like what we just did. And depending on the levels, we will start you off with the sheet that will tell you how many units, depending on the level of your blood sugar. And then you will inject using a syringe. Are you okay with needles?
I think so.
Okay, there are a couple different sites that you can give the injection. So you can do your abdomen, the back of your upper arms, or even your outer thighs. If you would like, you'll take an alcohol swab and clean the area, and then inject at a 45 to 90 degree angle. And do not massage the area after you inject it. And depending on the insulin that is prescribed, it may be long acting or short acting. It just depends. So the doctor will talk to you about that.
Can I have symptoms if I have too low of blood sugar?
Yes, and that is called hypoglycemia. And we went over that and the signs and symptoms. And what you can do for that is you can drink a half glass of juice or milk within 20 minutes of the treatment. And if the symptoms do not stop, then you should contact your healthcare provider. Eating a light snack might help as well if you have the low blood sugar, just to get some sugar in your body. And for hyperglycemia, you'll check your blood glucose, and if your blood glucose levels are higher than normal for 3 days in a row, then you'll want to reach out to your healthcare provider. Or even nausea or vomiting more than 6 hours, and even not eating for more than 24.
Like, what should I be eating for this?
Okay, so for your diet, we'll start with limiting fast food instead of cutting them out completely.
So no McDonald's? No Burger King where you can have it your way?
No, I'm so sorry.
No Popeyes?
But, yeah, no
I don't know if I can
binging.
do this.
Low carbs,
Okay.
low sugar, because the more sugar, the higher your blood glucose will be, including protein and fats in your diet. So meats, not red meat. Along with that, for other ways to help manage it would be to increase your activity. And I know you said that you are physically active when you go back and forth from the fridge, but we can try to increase that. by doing a light exercise, 20 to 30 minutes a day, 3, maybe 4 times a week. That could even be going out on a walk, walking to the mailbox and back, down the street, anything like that. Losing weight would be very helpful if that is something that you would be willing to do. Limiting your TV time if you play any video games. Having that sedentary lifestyle and not being active will put you at higher risk for those complications such as stroke, heart disease, kidney disease. And then when it comes to your skin, type 2 diabetes makes your skin more prone to breakdown. So you'll want to be checking your feet daily, wearing shoes and not walking barefoot. And if you do notice any skin breakdown or any changes in your skin, then just contact a healthcare provider.
Alrighty. I think I got a good grasp on this now.
Okay, sounds good. Do you have any other questions for me?
I do not.